Hello, everyone, and welcome to the special Women's Day edition of She Builds Health Tech. I'm Apurva, and today I'm joined by Riya Shaju, Director of Engineering at ABI Health. Riya has an incredible 20 years of experience in healthcare IT, leading teams at IBM, Mayo Clinic, and now at ABI Health. She's an expert in large scale tech solutions, data automation, and AI driven healthcare innovation. Riya, so excited to have you here today. Welcome.
Thanks, Agurva. I'm also excited to be here today.
Yeah. So let's start with something fun. Who are the three women that inspire you and why?
Okay, so three women that inspire me. First would be my mother, obvious reasons, right?
Yeah.
Unconditional love, a lot of sacrifices in raising us, raising the family. But beyond all that, for me, she was academically very proficient. So she was actually the state rank holder in her postgrad. And
Okay.
I never even came to know about it until later into life because she's so humble and unassuming. So she's a definite inspiration. Second inspiration for me is my mother-in-law. Just the opposite. She's only studied up till pre-degree, but she
Okay.
had so much drive in her life. In 1960s, as a young girl from Kerala, she wanted to work. So through some relatives, she found a job in Bombay in a foreign bank in Bombay, and she went there to work, convincing her family that it's the right thing to do, right? And
Yes.
she worked there several years before coming back to get married. So she's an inspiration. And third is my daughter. So she just finished her BTech and has joined a job, and she's very sincere and dedicated in everything she does. So now instead of me inspiring her, I think it's time for her to inspire me.
Yeah. Yes, that's amazing. So you have three strong women who always, push you to do the best in your family.
Yes,
Yes.
for sure.
Yeah. Okay, so now let's move on to some, technical questions and some questions related to your career. You have led teams across IBM, Mayo Clinic, and now at ABI Health. Was there any defining moment that changed the way you approach leadership in tech?
So, more than leadership, I'll just say a defining moment in my career, right? I
Okay.
think it was when I joined Mayo Clinic. Because till then, I was doing other product development, full stack development, etc. When I
Okay.
joined Mayo Clinic, I forayed into healthcare. And for me, that is a defining moment in my career. After that, I've never switched from healthcare because when you're in healthcare tech, you're making a difference to the patients that come to a hospital. So imagine, Ambudva, you go to a hospital, you're never a happy person. No person that comes to a hospital is happy, right? Either a
Yes.
patient or a bystander. You're going because there's something bothering you. So anything that you can do to make a patient's experience better in a hospital through tech, I think that's super gratifying. So healthcare tech, I think that was my calling, and I'm so happy I joined Mayo Clinic when I joined and
Hmm.
worked there for several years. And even after coming back to India, I joined a healthcare tech company itself. So that is the defining moment for me.
Okay. So you have you worked on any groundbreaking healthcare IT solution? Can you share any project or innovation that you're particularly proud of?
Right. So in Mayo itself, after I joined, after a few years, we were going filmless. There was this filmless initiative that was happening. So before that, if a patient goes to take an X-ray or a CT or an MRI, you will
Hmm.
be printed a film and given to you. Right.
Okay.
The X-ray
Yes.
will be printed on a film. So in the radiologist room, they'll have a PACS system where the radiologist can read the images and prepare the report. But for referring physicians, say you're meeting an orthopedic doctor or an oncologist, they will also want to see the film. So the patient used to take this film in his hand and then present it to the referring doctor. They'll put it under a light box and read it. They'll
Hmm.
have the report also, but they'll want to read the films. So with the filmless solution, of course, we are going green, reducing the carbon footprint, reduce printing. But more
Yes.
than that, lot of benefits, right?
Hmm.
The images would reach the referring doctor immediately.
Hmm.
No need of printing the entire image set will be available. Your prior images would be available for comparison, for example, to know if your tumor has increased, etc.,
Hmm.
or if it is reduced. And it's easy to get a second opinion from another doctor because then you're just sharing a link, right?
Hmm.
Just like what we are doing through a Zoom or a Teams meeting, they can share the images and get second opinions so easily. Everything, the impact was huge. So for me, that was a groundbreaking project that I was involved in, and it changed my viewpoint completely.
Okay. So any challenges while, because this film plus idea is very different, like it it is very different because you might have experienced that not many people will be comfortable without having a paper, a document, a hard copy of this. So have you faced any challenges?
Correct. So, yeah, the challenge about anything disruptive is adoption, right?
Yes.
So, when doctors are used to a certain way of doing things, and you're trying to convince them that this way is better, but you have to learn this software, you have to learn this, right? And especially maybe more experienced doctors who are more set in their ways. So, convincing them, that is the difficulty, and making sure it's adopted. Otherwise, if the doctor still says, no, no, I want films, I don't care what you guys are doing, I don't care about all this, I've treated my patients this way and that my entire career,
Hmm.
it's hard to convince them. But to convince them of the benefits of this, and at some point, once they understand the benefits, it's easy. But till then, it's always an upward curve.
Yeah. The tech industry is always evolving, but biases, conscious or unconscious, they still exist. Have you had ever had to push back the biases in the workplace?
If you're asking about gender based biases, fortunately for me, no.
Okay.
As you see in my the career path that you spoke about, I worked in few companies, longer stints in each company.
Hmm.
Um, and that was that way because I didn't have to face any biases. And even to talk about our current company, ABI Health,
Hmm.
Ajit is a very modern type of leader.
Hmm.
He leads the company in a very open and modern manner. So the work culture is very modern, and nothing else speaks. It's just your work. It doesn't matter. Nothing else matters. And but at the same time, I don't want to say that this doesn't exist anywhere, right? Because that would be wrong of me to say that. I'm sure it's rampant because I've heard from people that a woman has to speak louder to be heard, or she's always shushed, or she's not heard all the time, or disrespected by her team members. So even in ABI, if anyone is facing that, I think they should come forward, talk to HR, or even talk to me, and we should find a solution. So just because I haven't faced it doesn't mean it doesn't exist.
Yes, yes. It's amazing that you have such a, inspiring work culture that, does not discriminate against or, have any biases that conform, limits a woman to do her best to reach her potential. Yes. But, so tech is all about, logic and data, but leadership often demands emotional intelligence and intuition. Have you ever found a moment where EQ mattered more than IQ in decision making?
Okay. So I was obviously a software engineer, senior software engineer, etc. before I got into management and leadership, right? But I definitely feel that as you foray into leadership, EQ, the emotional quotient, definitely matters more because it's three things, right? Experience, obviously, right? You
Yes.
learn and learn things. Then motivation. Why do you want to be a leader? It should not be about power or money. It should be something more than that. The emotional satisfaction that you get in being a leader. And the third one, I feel the most important one is flexibility. When I first started leadership, I had very strong point of view, and I thought that I'm right, and
Hmm.
very strong that moral code of justice, ethical code of justice, and I failed to see the big picture in the beginning. But after talking to other leaders, hearing out their perspectives and understanding, having, I think what is important is having the humility or being humble enough to understand that you're wrong, your perspective is wrong, you're not always right, right? It's not always so black and white. So
Hmm.
that kind of flexibility is very important in being a leader. So yes, you're right. I think EQ plays a huge part. Yes.
AI is transforming every industry. How has AI and automation changed the way healthcare technology is built today?
Okay.
Hmm.
So AI can actually make a lot of difference, and it's already making a lot of difference in healthcare, right?
Yes.
So In layman's terms, if I'm trying to explain diagnosis, now why do you go to a hospital? To get a diagnosis, right, on your condition. So you have these symptoms, you're asked to take these tests, you're asked to take these radiology exams, and AI can help go through all these data very fast and come up with some answers, right? So
Hmm.
it can help with diagnosis. But then again, AI, these kind of models are very dependent on the data. So if the data is biased, the results of the AI can also be biased. So it's very important that there's a clinician there to make sure. So it is more about assisting the clinician at this point. The clinician can be assisted to make a correct diagnosis. So diagnosis is one. Treatment is another place where AI can help in tech. So a patient with diseases such as rheumatoid arthritis or autoimmune diseases, where the treatment varies depending on the patient, their genetic markers, their current parameters, AI can help in coming up with the right treatment. And even prediction of diseases, AI, because it's able to do pattern recognition and the NLP models and all that, it's you're able to predict diseases, whether you will get a chronic disease in the future,
Hmm.
like a diabetes or kidney disorders. So though all those areas, and obviously in medical education and research, clinical trials, everywhere, every part of healthcare, I feel AI is hugely transformative, and it can help healthcare immensely.
That's great to hear. Nowadays, AI is like everywhere, and that I feel that healthcare is also not far behind in adopting this that can help patient immensely. Right,
Absolutely.
yes. You are at forefront at ABI Health Engineering. Are there any upcoming project or innovation that excites you the most?
Okay. So, ABI Health, we have a lot of products.
Okay.
Um, so we have our RCM solution, we have with Attune our LIMS application, we have smart reports, we have packs, we have HIS. But in the interest of time, I'll talk about a couple of applications, right? So RCM, so Claimbook is our revenue cycle management application. It helps in the cashless workflow in hospitals. So
Hmm.
what is Claimbook? In a hospital, you have your insurance desk and the claims desk. You go with
Hmm.
an insurance card, you're a cashless patient. The claim book is one window where the insurance desk can manage your entire cashless workflow. They can get your pre-authorization done for your treatment. They can get your discharge approvals done through claim book. After that, do the claim submission and make sure the money is received for whatever different payers it is whatever TPS, whatever government portals it is, different for different payers. You still have one application, which is claim book. So
Hmm.
in one single window, the entire cashless workflow can be managed. You can go the from the hospital perspective, the uses are numerous, right? They can see the outstanding for each payer, how much money they have to receive from each payer. They can reconcile every case. All of these things are there. And from the patient perspective also, fast discharge. So if you were ever a bystander or a cashless patient yourself, you would understand what I'm saying, because when you're in a hospital, maybe the doctor would come in the morning and say, okay, you can be discharged now.
Hmm.
And what happens more often is that you will have to wait until late evening to get your
Hmm.
discharge. And the
Correct.
reason for that is the TPA, the insurance company, has to approve the bill, and only then they'll discharge you, because you're a cashless patient,
Hmm.
right? So
Hmm.
the day the patient will be waiting. So inconvenience to the patient, the bystander, everyone. Inconvenience to the hospital also, because your bed and room are occupied. You can't admit the next patient until this bed is freed up. So
Hmm.
multiple reasons here. So the application helps in all these perspectives to reduce the TAT, the turnaround time for approvals, and making sure your submission has everything. And nowadays, what we're doing, a lot of RPA is done, robotic
Hmm.
process automation is done in Claimbook to talk to the different portals, and web automation as well. And now through operator AI, we are trying to do again a lot of web automation to make sure we get the right responses at the right time into Claimbook, so that the hospital staff doesn't need to go into these insurance portals at all. And AI agents are being brought in again for different small utilities in Claimbook, right?
Hmm.
To through documents and make sure, for example, discharge summary is a mandatory document that you need to submit to the payer. And hospital might say, okay, I've submitted a document called discharge summary. We read the name, okay, it's great. But how do you really know that it's a discharge summary? Maybe they just uploaded something else and renamed it wrong as a discharge summary. So with AI agents, we'll be able to scan through the entire document, make sure all the appropriate parts of the discharge summary is there, like diagnosis, treatment, next steps, whatever, right? So
Hmm.
all these utilities are brought in, and it's very interesting. And this is done to make the entire packet that we submit to the payer perfect. That is the idea, so that there are very less turnarounds. So we don't
Hmm.
want the payer to come back and say, hey, your discharge summary is not great, please send it back again. And then you're again losing 1 or 2 hours, because you send it back, then the payer again, it goes to the bottom of their queue. They have to go through it again. So get it right the first time itself, so you get a faster approval. And we are trying for things like that. So that is on Claimbook. And another product is Smart Reports. So Smart Reports is a very interesting product as well.
Hmm.
You go to a hospital or a lab to take your annual checkup, right?
Hmm.
Say maybe your mom, right? Women over 40 or men over 50 take an annual checkup at a hospital or a lab. At
Hmm.
the end of their annual checkup, they'll give you a two-pager. All your tests will be listed in that printout, and some tests will be in bold to indicate
Hmm.
that is out of reference range, right? And then you go to a doctor, and he'll mostly be worried about things that are very critical, and then suggest you the next treatment. What we do with Smart Report is every single test in there is explained in layman's terms. So we explain it to the patient, and any test that is a little bit outside reference range, we go deeper into it. We'll tell them these are the health conditions that you can possibly have if this goes on like this. We analyze the trends from previous visits, and we tell them the path. So it's more of a wellness type of report. Okay,
Hmm.
these are the diet advice you can take. For example, if the creatine level is a bit high, these are the diet advice you can take to try and reduce your creatine level. These are the lifestyle tips that you can do to reduce your lipid,
Hmm.
or your cholesterol, etc. So those kind of insights are provided through a Smart Report. And again, I would like to reiterate, that doesn't mean that you don't have to see the doctor after that. You still have to see a doctor,
Yes.
but it explains to the patient in
Yes.
much simpler terms. And normally here, whenever we see a doctor, we get 5 to 10 minutes, right? It's all very, very fast.
That's
So
correct.
more descriptive, a lot more descriptive. So maybe you can also ask the right questions to the doctors also,
Hmm.
and get it going in a better way.
Wow, that is interesting innovations that you're cooking up there.
Yes.
So you have a 20 years of experience in, health tech innovation. So what is the best career advice that you have received?
Okay. I think the best career advice I've received was from my manager in Mayo. Uh, he was just this great leader.
Hmm.
Um, so I learned a lot from him, and he suggested that I take a leadership route. And I
Hmm.
think that was the best career advice for me. I learned a lot from him. And I always feel if I'm 1/10 the leader that he was, then I would be a great leader, because yes, the soft skills, the decision making, the way he could nurture talent, identify talent, all that was just amazing. He could read a room instantly and be able to speak to the room. I think he had a lot of capabilities as a leader, and I learned a lot from him.
Amazing. So we have talked about your work, but now let's switch gears. What are your hobbies or guilty pleasures outside the tech?
Okay, yeah, lots, right? So, spending time with family, watching TV, we go out to the theaters and watch movies. Watch sports. Actually, we do catch IPL games in stadiums and all that. So, yeah, yeah, we do a lot of entertainment kind of
Hmm.
things at home with family. Those are my guilty pleasures.
Okay. This has been such an insightful conversation, Ria. And before we wrap up, I have some fun rapid fire round for you. And I'll ask you a few questions, and you have to answer with the first thing that comes to your mind. No overthinking, just quick, instinctive responses. Ready?
Okay. Yeah, sure.
Yes. If you could have dinner with anyone, living or dead, who would it be and why?
Steve Jobs. Obviously, coming from tech, I think a lot of people would answer the same. Such a visionary.
What is the last book you have read?
I don't read a lot nowadays, actually, but the
Okay.
last book I read was A Man Called Ove. That was the last book I read. It was later made into a movie also. I think it's called Man Called Otto or something. Tom Hanks was acting in it, but Man Called O. That is the last book I read.
One app you can't live without.
WhatsApp.
Morning person or a night owl?
Night owl.
If you had to switch careers today, what would you do?
Psychiatrist or a
Psychiatrist.
psychologist. Yeah, psychiatrist or a psychologist.
That was fun. Thank you for playing along, Riya.
Yeah, thank you, Apurva. It was fun.
Okay, now before we close, I have a last question for you. What are the key pieces of advice you would give to women who are working in health tech?
First of all, I think you're at the right place. So health tech is the right place
Yes,
because think about it, right? Whether it's an upward turn in the economy or a downward turn, healthcare never goes down because it's always required, right?
yes.
So as far as security, job security kind of things are concerned, healthcare is the right place to be, I always feel. And even otherwise, you're making a difference. You're making a difference to patients. Like I said earlier, for me, myself, that was a defining moment in my career when I switched to healthcare. But the advice I would give in tech is any software that you're building, if it's a healthcare application, remember it is a mission critical application in the sense that, for example, PACS, right,
Mm,
where in the operation theater, they might be using your application to view the images. So you cannot have any defects in your application. The QA, the testing, everything has to be perfect. You have to always remember that this particular application may be used for the care of a patient. So it's like a life and death situation at that point. So be very careful. You're dealing with human life. So not directly, but through tech. So
mm.
be very careful when you design the applications, when you write the code, when you test the code. I always tell my team as well, we are in healthcare. That means we have a lot of responsibility. The responsibility is there because we are in some way impacting the health of people, right? Patient healthcare. So whether it's medical or wellness, even like I told you about the smart reports application, etc., the right advice. You can't give wrong tips in your report, right?
Yes.
Everything has to be done correctly. The content has to be vetted by medical professionals. The coding wise, the rules, the logics, the AI, everything has to be as perfect as it can be. So that's the advice that I would give, not just women but anyone coming into tech, health
Uh,
tech.
That's a great advice, and I'm sure our audience will find it inspiring. Thank you so much, Ria, for sharing your journey and insights with us today. It's a pleasure talking to you.
You, Apurva, it was nice talking to you as well.
Yes. And to all the incredible women out there, especially those breaking barriers in health tech, keep inspiring, innovative, and leading the way. Wishing you all a very happy Women's Day, and let's continue to celebrate and uplift each other. Until next time, take care and stay empowered.